So I am going to also talk about Dercum's disease, and the title of my talk is Tissue is the Issue. And there are my disclosures, as I've shown previously. So I know you've reviewed Dercum's disease. Let me do it as well. Dercum's disease was first described in 1888, and its hallmark is painful masses in the fat tissue. And these painful masses can be as small as a grain of sand, and they can be diffuse grains of sand. They can be the size of a pearl or a pea. They can be marble size, or they could be fist size or larger. And there are many signs and symptoms associated with Dercum's disease, kind of like fibromyalgia. So fatigue, anxiety, abdominal pain, shortness of breath, and migraines. And in about 40% of individuals with Dercum's disease, there are angiolipomas. And angiolipomas are vascular lipomas. And as I mentioned earlier, about 5 to 30 women are affected for every man. We also know that Dercum's disease has altered lymphatic vasculature, it's thicker, and it does not function as well as normal lymphatic vasculature. And metabolic syndrome is very common in Dercum's disease, and this is that pre-diabetes state, and diabetes is also common in Dercum's disease. This is a picture of what Dercum's disease can look like. As you can see, this man has had multiple lipomas removed from his abdomen, and I always say it looks like he got hit by shrapnel. And this is the extent that people will go to get angiolipomas removed because they are so painful. There has to be a better way. And this is a woman with Dercum's disease and angiolipomas who has used the heating pad on her back for so long, it's caused her skin to turn brown. So the pain is so significant that she's overusing treatment measures. This is an example of a histology showing a lipoma in Dercum's disease. And I don't think anyone could argue with us that that does look like a lipoma, right? And when I was removing this tissue, I just made a small incision, and this lipoma came out, and I took it, and I was done, and then another one came through the opening, and so I took that, and then another one came through the opening, and they just kept coming. So that's not normal fat tissue. Normal fat tissue usually stays in place. On the right side of the screen, you can see that the fat cells on the top look normal, and on the bottom, you can see the angiolipoma tissue that you saw with Dr. Al-Gadban's talk, where there are many blood vessels within the fat tissue, and those blood vessels surround and eventually kill off the fat cells. And this is what an angiolipoma looks like up close. And this is one of my favorite pictures, and I've showed it before, and I'll probably show it again. But you can see the dilated capillaries over there on the right side. And then there's some very clear junk in the middle, and then there's a dead blood vessel. And that clear junk in the middle is a clot. And so that vessel's been clotted off, and that vessel is dead. And so in angiolipoma tissue, there's not just a lot of blood vessels, but there's clots, and there's dead fat cells and dead blood vessels. No wonder it hurts. These blood vessels can take up to 5% of the space of the lipoma, or up to half the space of the lipoma. And they're usually grouped together, and they're dilated, so larger caliber. And in the angiolipomas, there are a lot of mast cells. So if you have angiolipomas, you have a form of mast cell disease. You have more mast cells, and these mast cells are very active. And you can get all the signs and symptoms of mast cell disease, including flushing, itching, fatigue, etc. There are also these fibrin thrombi, so they're made of fibrin, which are threads, and dead tissue, as I mentioned. And if you block off a single arteriole in the brain, you can experience considerable cognitive decline. So if you block off multiple arterioles in the fat tissue, what is that doing to the fat tissue? It's creating a very, very different environment in the fat tissue than normal. This is an example of a mass or a nodule or a tumor in Dercum's disease, and I've outlined it there. I hope that you can see that, so I'm going to do that again. And there are actually multiple nodules, and you can see ones that are just below the dermis, just below the skin. There's like a little round area. That is one of those grains of sands that you feel. And this ultrasound was taken with Vivo 2100. It's a high-performance ultrasound. We use a 70 megahertz probe to see just under the skin. So it's kind of like a biopsy without the cutting. Here's another example of a lipoma here. You can see that. And this is on the forearm, so it's occupying a huge amount of the fat tissue on the forearm. And again, you can see all the small nodules under the skin. The whole entire fat tissue there under the skin is changed. And this is a man who has an angiolipoma. Another example of an angiolipoma, you can see the swirls around that oblong structure. That is a capsule. So sometimes the body will cordon off these lipomas or angiolipomas to try and seal them in so they don't cause any damage, and this is one example of those. And then you can see inside, you see some bright kind of long wavy streaks in there. That's connective tissue associated with the blood vessels. So you can almost see the blood vessels in this ultrasound. And on the bottom right area, you see by the word vessel, you can actually clearly see that vessel. You see the lining of the vessel is thick and white. That is not normal. So that thick vessel is the result of inflammation and fibrosis. So the blood vessels that are in angiolipomas and in Dercum's disease are not healthy. And we also see these holes in the tissue. And nobody believed me that there were actually holes in the tissue. And one of the investigators that I work with came in the room while we were scanning, and I said, "Come look at this hole." And I showed it to him, and he said, "That's a hole." And I said, "I told you there is a hole." And what we think those holes are dead blood vessels, just like I showed you in the picture before. And the angiolipoma vessels don't just sit within the fat tissue, they actually grow up into the skin. And you saw that from Dr. Al-Gadban's work in lipedema. And this is just an example with an angiolipoma. And the blue and red colors are just showing you the different flow of the blood in the fat and up into the skin, which is that whole top white part. And when you look down on skin, it should be all purple. That's the epidermis. But you can see the pink dermis below it is growing up into the epidermis like little mountain peaks, and it's taking those vessels with it. So when you touch the skin of your angiolipoma, you're touching those vessels, and we think that those vessels are tender, and it's part of the reason why you feel pain when you have angiolipomas, because vessels are very well integrated with the nervous system. And we saw that earlier with the sympathetic nervous system, right? So in ultrasound of Dercum's disease, we see nodules and lipomas very commonly. We can actually identify the angiolipoma blood vessels in the fat and the skin. And there are no real clear ultrasound criteria to identify Dercum's disease except for angiolipomas or lipomas, right? That's it. There's no real good criteria that says you have this or you don't. So we need to look deeper in the tissue. So in Dercum's disease, it's been reported that the fat cell size is normal, but it's also been reported that the fat cell size is larger. So I decided we have a disparity here. We need to go in and figure this out. Are they larger or are they not? And why is that important? If you look at a population of people who are not overweight, they're not obese, they're normal in size, if they have diabetes or not, The ones that have diabetes have these large fat cells. The ones that don't have diabetes do not have the large fat cells. And if you have large fat cells, this is correlated with releasing more fat into the blood, so your blood is fatty. That's not a good thing. It's associated with insulin resistance or prediabetes. That's not a good thing. And it's associated with the release of inflammatory proteins, kind of like what Dr. Dan Pulsifer was talking about. And these large fat cells, when they're in an area of fat that you can't expand, they're a marker that that excess fat spilling into the blood is going and being deposited in the liver and into muscle and other areas of the body. So again, not good. And this is an example of the ectopic fat. So this is a paper that we published with some residents to get them involved in learning about Dercum's disease. And on the left side, the far left screen, you can see the liver. And in that man, the liver is full of fat. And there's a little arrow over that rainbow bar, and that little arrow is in the yellow region, and that means that there's 16% fat within the liver. Normally, it's supposed to be less than 4%. He had 16%. So we put him on dextroamphetamine, and he lost weight, so about 30 pounds, and his pain improved, and we re-imaged his liver all the way over on the right, and his fat was all gone in his liver. And you can see that little white arrow on the rainbow on the top moved within the normal range. And then he went off the dextroamphetamine, and the fat stayed out of his liver for 3 years, which is pretty cool. Now, everyone asks me, can I have lipomas in my liver? Can I have lipomas on my intestine? Can I have lipomas on my heart? This is a woman who had 2 lipomas in her liver, and she has Dercum's disease. So, and it's kind of hard to see, but just take my word for it. If you could look closely, you could see the little dots, but there are 2 lipomas there. We put her on dextroamphetamine for a year. She lost about 20 pounds. Her body pain and swelling went way down, and the lipomas disappeared. So I think there are ways of improving ectopic fat in Dercum's disease. Again, I don't think amphetamines are the entire answer. I think we need more supplements and medications such as what Dr. Pulsifer was talking about. So when you grow big fat cells, you also grow more blood vessels. And you also collect more immune cells like mast cells and macrophages in your tissue. And when you have large fat cells, remember, you also have water or fluid, hyaluronic acid or gel, and you also have increased fibrosis, including collagen type 6. So we enrolled non-obese and obese participants who had Dercum's disease, and compared them to controls. And most of our group was females, but we had some men who participated. And the non-obese are obviously non-obese. Their BMIs were 22 to 25, and the BMIs of the obese were above 30. And we looked at the fat cell size, and we said, is it larger? And sure enough, in Dercum's disease, the fat cell size was larger than that of controls if they were not obese. Once you become obese, even if you don't have Dercum's disease or lipedema, your fat cells become larger, and you approach that prediabetes state. So you can see that the control fat cell size increased with obesity, and then there was no difference. And as I mentioned, immune cells come into the tissue when there is an increased amount of fat tissue and large fat cells. So we looked at macrophages, and you can see that the macrophages were much higher in the non-obese patients who had Dercum's disease compared to controls, and that was pretty significantly higher. We need to enroll more patients in the obese group, and we're going to do that, but you can see we're moving in that same direction, that mast cells may be greater in patients who have obesity and Dercum's disease. We also looked at mast cells. Now, mast cells are associated with angiolipomas. They're associated with mast cell activation disease. We talk about this commonly in Dercum's disease, and you can see whether the research participants were not obese or obese, it didn't matter. Their mast cells were higher than in controls. we found that T lymphocytes were similar between the two populations, but as you heard from Dr. Pulsifer, there are all different kinds of T lymphocytes, so we need to look at the specific T lymphocytes that are in the tissue. And this is a picture of skin. You saw that from Dr. Al-Gadban's lecture. You got your epidermis, you have some very simple looking blood vessels, and then you have your dermis. And you can see in Dercum's disease, as in lipedema, these blood vessels are growing up from the dermis and reaching into the territory of the epidermis. This has not been reported in the literature except in psoriasis. And we know that people with lipedema and Dercum's disease don't have psoriasis, so this is a new finding. You can also see how convoluted and extensive those blood vessels have become. They're not simple blood vessels anymore. They're dilated, they're twisting and turning, and so they're definitely different from normal. They're in a process of change. And we counted these blood vessels as well. Actually, Sarah and Marisol counted these blood vessels. And you can see in the lower part of the dermis that the number of vessels were greater in number if in the non-obese Dercum's disease. And the trend is getting there for the obese. We just need to add more participants. So in summary, I think Dercum's disease tissue is a stiffer tissue. It doesn't expand as well, and there's spillover into the liver and other organs. There are microvascular clots, and there's dead fat tissue in the body of people with Dercum's disease. There's a lot of inflammatory cells that are in the fat and in the skin, especially around blood vessels, and I think that's where a lot of the pain originates from. And there are also larger vessels in the skin that are growing up to the top of the skin, almost like they want to escape. And the skin is tender, and I think that this suggests that the vessels may be a primary source of pain. So I think improving the health of blood vessels and reducing inflammation should be goals in Dercum's disease. And just to do a quick review of the literature of new papers that have come out, this is a case report of a woman who developed Dercum's disease around her knees. She was given a new monoclonal antibody drug called tocilizumab, and it's a humanized monoclonal antibody, and it's targeting the interleukin-6 receptors. And interleukin-6 is one of the nastiest cytokines that floats around our body and is involved in inflammation, and they are trying to block that. And she developed Dercum's disease around her knees, and you can see in this MRI picture, it was all fat. So she grew massive amounts of painful fat on her knees, and what do you see? Redness. What is that? Blood vessels, right? And we've just finished talking about how inflammatory cells surround blood vessels. And there's one other report, and then I'm done, about trauma-induced Dercum's disease. So this is a man who had a motorcycle accident about 5 years before this case was reported, and he started experiencing painful nodules in the area where he had trauma during the motorcycle accident. And when they did his MRI, they found these small nodules throughout the tissue, and those are shown by arrows there. And you can see them. Those are the little round dots. Some of them are too small for you to see, and some of them are larger, again, demonstrating that there's a range of nodule size in Dercum's disease. So if you have Dercum's disease, or even if you have lipedema, the more trauma you experience to a region of the body, that can actually cause fat to grow. And this is why we have to be careful with surgeries, especially surgeries with larger incisions like hysterectomies and knee replacements and hip replacements. So I want to thank again the TREAT team, Lipedema Foundation for their support, and also the Dercum's Disease Rhode Island Society for their support as well. Thank you very much. Can I take questions? Yes, David. Yeah. So the question is, what comes first? Like, for example, in Dercum's disease, do you get your lipoma first and then your inflammation, or do you get your inflammation and then you get your lipoma? And honest to goodness, I really don't know. However, I will say this, a lot of people with Dercum's disease say, I felt this sharp pain and I rubbed it and there's nothing there. And then the next day I found a lump. So it seems like pain comes first. What is the pain? And I think the pain is associated with damage. And it's likely damage to a blood vessel. That's my thought. So I would say blood vessel damage, or there's an area that's no longer has good flow, and the vessels were sitting in a soup, and then they broke. So in that case, inflammation could come first. So I don't think we really know yet. So the question is, if you have Dercum's disease, then you have to have a surgery, and you know that happens. You have to have your knee replaced, or you have to have your gallbladder removed. It would be doing, we don't have enough time obviously to do it, but it would be doing all those self-care things that you can do to take care of yourself, eating healthy, making sure that you're exercising, making sure that your tissue is as healthy as it can possibly be, using manual hands-on therapies, you know, some of the supplements that Dr. Bartholomew mentioned, etc. And actually the FDRS had a talk about how to prepare for surgery in the past, and you can watch their YouTube channel. So the question is, should we be using blood thinners such as heparin, which has not only properties that allow it to prevent blood clots, but it also has anti-inflammatory properties. And I think that that's where we're going right now, is we're looking at some of these anticoagulants to see if we can break down the clots that are in the angiolipomas and improve flow. So you're spot on. Thank you so much.